Hello, today we'll talk about a common sports injury called the tennis elbow. Tennis elbow quite commonly occurs in sportsmen who do play tennis, but it's seen in other sports as well. Usually, the players suffering from tennis elbow complain of pain on the outside of the elbow. So when they present to a doctor or somebody like me, we get a good history, we examine them, we'll go in detail about their training plans. Was there any tournaments they had played recently, tournaments that are going to start soon, and all this will help us to provide a good treatment plan for them. So what is tennis elbow? Tennis elbow is what is considered as an overuse injury. So for example, this is the model of an elbow joint. You can see the joint moving this way. This is the humerus, the arm bone. These are the two forearm bones. This is the radius and the ulna. So you have a group of muscles that come and attach on either side here and here. So these are so one group of muscles comes and attaches to the outside on the radial side. So these muscles, they extend the wrist. Okay, so it is an overuse of these muscles that causes pain here when they get activated. So clinically we do some tests to confirm whether a patient has tennis elbow or not. So once we know the patient has tennis elbow, then we go on to the treatment aspect. So normally we do get a detailed history about why this patient might have developed tennis elbow. So suggestions start from simple things like changing the guts of the racket if they haven't done so recently. Increasing the width of the grip also helps. Forearm bands which offload the working of the muscles also help. But what is more important is going into how frequently they're playing, what kind of training they're doing. So for example, if they're doing too much of wrist extension exercises, that itself can overload the muscles here, and that can cause the symptoms, in which case they have to decrease the frequency of that particular exercise. So it's very important to go through all that and advise appropriately to the patient. So these are the preventive aspects, of course, but to the actual treatment part of it, we have some specific eccentric strengthening exercises that we can recommend them. Usually by and large they help, but if they don't help, we go to the next stage. We have suggestions to give some injections. One injection, of course, is a PRP injection called platelet rich plasma, where we take a blood sample from the patient, centrifuge it, concentrate the growth factors and inject it. And of course there's another type of injection that has been traditionally used, which is a local anesthetic and a steroid as well. So most of the symptoms do get better with these kind of management plans. I would say 90% of them do get better, but very, very rarely, if none of these help at all consistently over a period of time, then of course we do perform surgery, but very infrequently, I should say. Hope that helps. Thank you.